Dear listeners, I'm excited to share with you about my interview with Dr. Kalissa Pudi, a psychiatrist who spent many years working with elders. In our interview, Dr. talks about the different forms of dementia, as well as innovative and creative solutions to dealing with loneliness and isolation among the elderly. One of the key things in our interview is dealing with cultural sensitivity among different racial and ethnic groups. Stay tuned. Welcome, Dr. Kalisapudi. It is an absolute pleasure to have you here. I am looking forward to our discussion, long awaited discussion. I know that you're extremely busy, so I really do appreciate your time. So please share with us who you are, a little bit of your background, and about India Home.
Thank you, Dr. Ganesh. I'm sorry about the delay, but anyway, finally we are here. My name is Vasundhara Kalasapudi. I'm an immigrant from India. I came here in 1988. I did my medical school in India and did some research in Paris and also in New York. And later, I got trained in the field of mental health, psychiatry, and with a specialization in geriatric psychiatry. And the reason why I'm involved here with India Home is it's actually a personal story. I lost my father with vascular dementia. It's more than 18 years ago. And when I never thought I went to medical school and got trained in psychiatry as a specialty to diagnose my own father with vascular dementia. It was a painful thing for me at that time to go to India once in 3 months so that my memory will not erase from my dad's brain. And my sister and brother-in-law took care of my parents towards the end of their life. At the same time, a friend of mine, Dr. Dave, Kiran Dave, took care of her mother with Alzheimer's dementia. And that friend had to quit her job as a geriatric psychiatrist to care for her father with Parkinson's disease. That's where we were involved in this. And I'm one of the founding board members of India Home, which is a South Asian senior care organization dedicated for South Asian seniors. And currently, I'm the executive director of India Home.
Oh, terrific. Thank you. And thank you for sharing about your story and your background and training and how that fits so well with your personal to help your life and the life of your parents and your family as well. So, Dr. Kalisapudi, so here we are, psychiatry, and your focus is on geriatric psychiatry. So, can you share with us what are some of the diagnosis, the experiences, and or lived experience of the patients that you have seen and what you have encountered throughout this long career in geriatric psychiatry?
And actually, we call it as 3Ds, which is depression, which is a very common because of social isolation seniors are facing, and dementia, which is a memory problems related. It could be Alzheimer's or vascular or any other type of medical reasons for developing dementia. And also long term of not having social interactions also can over a period of time can cause the dementia also. And delirium, when sometimes the seniors, when they get admitted to the hospitals with a medical problem, it could be heart related or lungs related or kidney or whatever, urine related or lungs, they develop a period of confusion, which is called delirium. And of course, unfortunately, towards the end, as a part of the medical problems, we also have to deal with the seniors dying, right? That is the fourth.
Yes. Mm-hmm.
And what we do at India Home is actually more like a preventive services. So we provide the senior care services, senior centers, more like a prevention of our goal is to prevent the dementia and depression. That's what we do. But in hospitals, we encounter most commonly with the delirium, dementia, and depression, which is a very, very common thing in geriatric population.
Yeah, I want to go back to India Home in a second, but just to sort of to touch upon the 3Ds as you mentioned. So it's interesting what I'm learning is the issue of sort of dementia is the sort of the umbrella term. And within that term, we have Alzheimer's and other mental health conditions that affect dementia, correct? Okay, great.
Yes.
Okay. So please share with us in their home. I can't wait to talk about our needs assessment study and how what we found with that. But please share with us about in their home, the type of services you provide, and the community you provide it for.
India Home was started as a small not for profit in 2007. We registered this because myself and my friends, when we went through quite a bit with our family members being affected with dementia and Parkinson's disease, we realized there is a huge need for it.
Mm-hmm.
So we had like so many dinner meetings at home. We invited our professional colleagues and personal friends and community members over a period of 10 meetings in a year. 200 people attended. So we had an
Wow.
informal discussions and everybody said, yes, there is a need for this services and we need to start something. That's when we registered this in 2007 as a not-for-profit. And 2008 onwards, we started collaborating with existing senior centers. There are
Mm-hmm.
more than 200 senior centers in Queens, in New York City. And there are South Asians living in some neighborhoods, but they are not going to the senior centers. When we asked them, what is the reason why you're not going to the senior center? They
Uh-huh.
said language is different, food is different, culture is different. So with one of the senior center executive director, it's called SNAP, Services Now for Adult Persons. We met with them and we had conversations over a period of 3 to 6 months. We showed them how our South Asian food is different than what they supply. We took them to a restaurant, local restaurant. We said, this is what we eat on a day-to-day basis. And I also gave a lecture about the cultural differences. For example, in American Senior Center, they call, okay, Mr. Smith or Miss Jones, something like that.
Right.
Whereas in South Asian culture, people would expect, like, you have to respect them. We cannot call Janki. We have to call them Janki ji, or, with a G, with a respect. Or
Okay.
sometimes they would expect you would call them as uncle and auntie.
Right.
Even if you don't feel comfortable, you would respect them by adding G into the first name.
Right.
So there are cultural differences and, our festivals and languages. We have at least more than 25 different languages. And the food habits are different too, because in our senior centers right now, to serve Bangladeshi Muslim seniors, we provide
Mm-hmm.
halal food. Whereas the Indian seniors and Indo-Caribbean seniors who are coming to the temples, we serve vegetarian food over there. So there are so many differences, and that's how we convince them. And they opened the doors for India Home Seniors. And Dr. Leena Doshi donated a bus, and she donated 100,000. And our board members, we all raised another couple of $1 million to start these activities. And of course, later we started getting some government funding. But mainly the senior center activities, what we do over there to prevent this social isolation, that is the target.
Right.
So the seniors would come and, chit chat a little bit about their personal life, what's going on
Mm-hmm.
with their family and friends circle. And then every center will have a yoga or a physical therapy or physical exercise or how to prevent falls and things like that. Something related to physical exercise. And later a congregate meals. And also we organize some lectures, whether
Mm-hmm.
it is legal aspects or whether it is medical aspects. And we do organize trips and for their picnics and stuff like that.
Terrific. So your catchment area it will be senior South Asians in New York City, correct?
Yes, yeah, yeah. Right now we are mostly focused in Queens because
Mm-hmm.
there's a lot of South Asian seniors living in different pockets of Queens.
Yes, absolutely, absolutely. So, what are you seeing, Dr. Kalisapudi, in terms of the clients or patients that are presenting to you, in terms of what their needs are? If and you talked about the language barrier issue, you talk about the cultural aspect, the traditions, customs, you talk about food. So, what are they presenting with? Like, what sort of problems are they coming to you with?
Yeah. The main problem what they are coming up
Hmm.
is a social isolation. Because once they retire, if they come to this country 30, 40 years back, and once they retire, the kids are grown up and they start having this emptiness feeling.
Mm.
And it's very difficult for them to, some of them they drive, some of them they travel, sometimes they can't do that because of transportation. Access to transportation is limited for them. That is causing them to be homebound. And in fact, some of them express very clearly, especially when they come from India or Bangladesh or Pakistan or Indo-Caribbean Guyana, French Guyana, and all, they
Mhm.
would tell very clearly, we are homebound. It is like a $1 million home jail. Their kids, of course, they live very successful. They are professionally very successful. They purchase good homes and all. But these people have no way to go anywhere. So that
Mm.
is a main problem. The socialization, lack of socialization.
Mhm.
And that itself is making them feel like, why are we living here? What's the purpose? And the other one is the purpose for their life. At one time, maybe back home in their countries or here, they worked as professionals or in various jobs. And
Mhm.
all of a sudden, just because they are retired and their skill set will not be less useful.
Oh.
So the purpose of the life also. At the same time, for them to access the healthcare facilities. Like some of them, they don't speak English. Like Bangladeshi and Nepali seniors who are recent immigrants, they don't speak English well. And sometimes they kind of, they don't know how to access the benefits, public health benefits, whether it is their insurance problems or whether it is their food stamps application or housing applications. So, with all these things, that's where the India Home is filling the need for all these aspects of the senior care.
Yes.
When we did, you remember the needs assessment survey,
Yes.
so many of these things, whether it is healthcare or housing or language barriers, they came up prominently into this, especially mental health. Yeah.
Yeah, absolutely. And that was sort of an unprecedented initiative that you did, where I've never seen that in the scientific literature, specifically Southeast Asians, seniors in New York City. And the fact that you were able to canvass over 1,000 subjects for this study and garner so much critical information about their access to healthcare, health seeking behaviors, as well as mental health with that focus as well. And that's where where we work together and we were able to publish our findings of the study about loneliness and isolation and some of the communities within the diaspora, senior South Asians, within their subsets within that community as well, and how we were able to sort of tease out who was really suffering the most in terms of loneliness and depression, isolation. And if I recall correctly, a lot of it centered around limited education, limited access to resources, as well as their time in the US as immigrants was also shorter than others who have been here and were more seasoned and more cultured and more sort of well resourced. So, one of the things I wanted to ask you in terms of you talk about being able to provide a service to help them to get government benefits that they have worked for and they are entitled to. And some of the that will be, I would imagine, Medicare applications. And I would imagine if there's a financial need or food insecurity need, helping them with food stamps and or providing other services. And what has been the experience with, because I know it's such a struggle for even English speaking
Yeah.
Americans, right? Or New Yorkers, right? So, like, what is that like for them? I would imagine quite challenging.
Yeah, it is. It's one of the biggest challenges we are facing. In fact, in 2016, we started our case management team.
Hmm.
And since 2016 to now, it's about 8 years, we have grown so much. We hired 2 full-time social workers and 3 full-time case managers.
Wow.
And the reason is, and not only hiring them, we have to be culturally specific. Like one of the case managers, specifically, she is devoted to Bangladeshi seniors because she comes from Bangladesh, she speaks Bengali, and she understands the cultural needs. And sometimes when they receive a letter from the government, whether it is SNAP application or whether it is the insurance application, they don't even know how to read about it. Forget
Yes,
about
yes.
responding to that, right? So they actually literally sit with them and make sure like they understand and they respond on their behalf. They would complete the applications for them. And we have one case manager. She's from Indo-Caribbean community,
Hmm.
and of course she helps out with overall every senior center whatever they need. And another case worker, another, she speaks Gujarati and Hindi, so that way they can serve the seniors. And our social workers also, one social worker, she's from Pakistan, one social worker from India. So they understand the different cultures and all. And some of the things we have gone beyond what is in the realm of public health benefits.
Yes.
We have a collaboration with a St. George Society, which was established some 250 years back to
Wow.
help the immigrants from the England. And of course, they expanded to all other countries also, India, Pakistan, and all. So they came and they said if a senior is eligible for a housing grant, do not have any other resources, they would come. It's a big, extensive process. Our social worker will do the financial needs and financial situation of the senior, and their social worker would come and visit the senior at their home. And they would, once the senior gets approved, they would give 625 or $50. I don't remember exact number, but it's little over than $600 per month for rental health for lifetime once they get it. But the approval process, it takes time. Our social worker helped at least 8 seniors getting that kind of rental help.
That is absolutely incredible.
Yeah, yeah,
Wow. Yeah.
yeah.
I mean, and this is all due to India Home and the efforts and sort of identifying these pockets of opportunity, which is far and few and very rare.
Yes, yeah, yeah. You need to make different efforts. It's not simply you're sitting in the office. Our social worker goes and visits the senior in the apartment, and
Wow.
she coordinates with the social worker from St. George Society. And they would come, and because they don't speak Indian languages or South Asian languages, our social worker would help them translate and help them. So it is, they go extra miles. Our staff walks extra miles to help the seniors.
Yes. One of the things that really what I'm learning is that the not just the application process for Medicare, but even being informed and
Mhm.
educated
Right.
about what Medicare is, what services they have for them, what options they have in terms of health insurance. And it's just very difficult to wrap your head around which one will benefit me or where I will get the most benefit from.
Right.
Yeah, I'm learning that that seems to be a challenge, and I would imagine for the community that you serve, it will be a challenge as well. How do you provide that service? Is it a one-to-one, or is it a orientation, or?
We do educate them about what are all the benefits available, but at the same time, most of the services we provide one to one. Because honestly, health insurance is a big thing in this country. As a physician, as a healthcare provider, I myself find it very challenging to
Yes.
look at, okay, what is available? Okay, if you have Medicare or if you have Medicaid, what's the secondary insurance? Which one would provide more services, right? And what's the monthly charges for them? What are the different services available? So they need almost like one to one
Hand holding.
coaching for that, hand holding, exactly.
I'm hearing that over and over again. And also, too, I'm sure that they're not as savvy with the online and
Mhm.
internet and the virtual space. And,
Right.
I feel as though they need three India home agencies, right, to really serve them adequately and because they need handholding for everything. So, which brings me to the next point where I know that we talk about healthcare and access to healthcare and Medicare. But what about there's an overlap, right? There's the overlap with legal issues, right? So I'm sure that they have come here and worked so hard. As you mentioned, they live in these mansions, but they're lonely, or
Yes.
their kids are well accomplished, and their kids have busy lives, and they want the best interests of their parents, but sometimes we don't know how to always do that. But they may want to leave something for their grandkids or their children or their family members. And how does that, or does India Home help them in any way to educate them and inform them on the legal aspect?
Sure. We do have collaboration with existing other not for profit organizations, and they can help them out, whatever legal aspects, either as a lectures or sometimes on one to one also. One to one counseling also with them. That is more, sometimes people wanted to form their trusts, and we help them connect with the local resources. And because we don't have any in house lawyer, but we have a lawyer who is a consultant for our housing projects. So we take her help. We also take other not for profits who are providing legal services. And we tell them at the same time, we also have collaboration with the district office, Queen's district officer, Melinda Katz office. So they would come to our senior centers and they would actually educate the seniors how to avoid the scams. Somebody
Oh,
would
yes.
call. Yeah.
Yes.
Somebody would call and say that, oh, if you don't pay this, we are going to report you or get you arrested and all sorts of things. So they help them. What are their rights, legal rights in this country, and how they can protect themselves. So it's like in name anything, if we don't have something inside in house, then we collaborate with all other organizations.
Thank you for doing that. That is so very important. And we know that they are so vulnerable and they're targeted constantly. And also very manipulating too, right?
Yes.
Those who are trying to target the elder, and they're asking them for some of these information, but the way they do it sometimes is I got tricked into that myself, and they took thousands of dollars from my account because I thought it was really my bank
Yeah.
that was calling. So I can't imagine, and especially with a language barrier, and if they're calling and they're threatening as well, saying that they are a government agency. So thank you for creating the opportunity for them to be aware and be able to defend themselves. One of the things I think that it's very devastating when I think about the type of sacrifice my parents made and the little earnings and that they have is then sometimes based on poor or being uninformed, and the decisions that family make is to lose everything
Yes.
that
Yes.
their parents have worked for,
Hmm.
losing the home to Medicaid, when
Hmm.
we know that there are options out there where they don't have to lose their homes,
Right.
or all the money, the little bit of money they have in the bank, where the kids can inherit that or benefit from it, or their grandkids, like
Yes.
you see with other more well established communities. And what has been so you do connect them with other non for profit legal services. What
Right.
about finance, Dr. Kalisapudi?
Yeah, the financial aspect, as much as possible, what we try to help them, if whatever they are eligible for. For example, if a senior is eligible for food stamps, we'll make sure like they get the food stamps so that some dollars they can save, right? At the same time, we also help them like a Section 8 housing applications. Like the Section 8 housing applications, I think it just got opened last like a week back or something. Now there are 80 applications they are doing so far. It would be more than hundreds in the next 1 or 2 days because there is a deadline and it's online, everything. So all the
Wow.
social workers and case managers, everybody is calling out seniors who are eligible for that, because that way their rental agreement will be, I mean, rental payment will be less, right? So in the transportation, for example, if somebody is eligible for transportation from the application for metro cards, 50% reduced metro cards, we do that. And at the same time, some of the companies and all, they give free cell phones, right? So we do the applications, we make sure the seniors get the free cell phones and with services and limited services. So these are all, when you bring out this public health resource, benefit resources, that means you are saving dollars for them.
Yeah, absolutely. It's saving dollars for them, and you're saving dollars for the government. You're saving dollars for it's a wise economic intervention, because we
Right.
know that the consequence of that
Mhm.
is ending up in emergency rooms, ending up in,
Sure.
emergency care. And we know how extensive and exhaustive that can be as well. So as much as we within, and I know that the services are limited sometimes for our seniors. And because I've experienced that with my mother, with my father, and my mother in law, my grandmother as well. So we know that it can be quite challenging. And especially for poor seniors, I think that there's this perception out there that they have services and resources easily accessible to them. And quite often that is not the case. And it's very exhaustive, extenuating process for them to then get whatever limited or minimal benefits that they can get. We know that Medicaid. Do you also help with Medicaid applications, or?
Yes, we do. We do. Whether it is Medicaid or anything health insurance related, we do help them.
Yeah.
It is an important thing, especially when you brought out this issue of the nursing homes taking away their homes and all. We try to help seniors if they meet certain, because to be eligible for Medicaid, they need certain requirements. So if they have little bit more money rather than what is needed, then we collaborate with another organization where they would come and help the seniors to form a trust or something so that they can leave little bit of savings what they did for their future generations and still be eligible for Medicaid.
Yeah, that's terrific that you're able to provide that. Now, The other thing that comes to mind is, as you're talking about this, is, what about actually accessing medical care and mental health care? What role do you provide in that respect?
Yeah. The mental health, of course, mostly we have been organizing the mental health talks at the senior centers. At the same time, we also collaborate with Asian American Federation, where they will give a little bit of funding to help out with the mental health services. Not only lectures and sometimes if there is a need on one-to-one counseling, but if they really need psychiatric medications and treatments like that, we actually refer them to the local hospitals like Jamaica Hospital and Flushing Hospital and
Uh-huh.
make appointments for them, arrange the transportation, talk to the doctors over there. More importantly, what we did in regarding mental health, interestingly, we found the differences within the South Asian community also. We got a grant from DOHMH to study the depression, GAD, depression and anxiety scales and substance abuse scales.
Really?
So, yeah, we did that and we realized between Indian seniors and Bangladeshi seniors, there is a huge difference to the point where most of the Bangladeshi seniors, they actually have more depression, more anxiety, and suicidal tendencies also. And that's
Wow.
when we realized for them, it was difficult for them to go out to the hospitals because of language barriers. So we collaborated with another organization called Sahara, which was started by a Bangladeshi psychiatrist. And we told her, come over to our office in the weekend. Use this office as your office here. And then you see the seniors one by one. We put her in one special room, and the seniors would be waiting in another room, and they would see
Really?
them, and she would talk to them and provide the prescriptions or supportive therapy, and with our social workers, of course. It was a eye opener experience for us to realize how important it is. We are not a clinic or anything, but she has her own license and malpractice insurance. So she would bring that and use our center as a temporary to see the seniors. I think during COVID, they were impacted disproportionately when compared to other seniors. That's where we thought we have to do something about it. There's still so much to do. We started a dementia day program last year. It's almost a year over, from mild to moderate dementia, whatever variety of dementia, whether it is Alzheimer's, vascular, or any other variety. They can come over here. We provide the services for them and we provide transportation for the seniors to come. And also for their caregivers, their family members also can come with them. We provide support services for their caregivers. And not only our staff members, we also have community volunteers to help them, whether it is a yoga or music therapy or sitting with them and play the cognitive challenging puzzles and games and things like that. So,
Wow. Uh-huh.
yeah, there are many things going on in the mental health.
Yeah, which is absolutely terrific. And we also know that that's often overlooked and it's not really, there's really limited focus. And what value you bring to their lives as folks who have came to this country and made incredible sacrifices for their families and seen the results of the success of their families, but still in their own lives, very lives are suffering, right? And whether it can be dementia, or depression, or loneliness, or isolation, and bringing these resources and having it available to them and growing and expanding on it, I think is absolutely incredible. And this is news for the time since I've been to India home. So this is really wonderful to
Yeah,
hear.
we just started last year, May.
Yeah, this is terrific. So one of the questions I had here was, what sort of family dynamic issues that may influence or impact the loneliness and isolation? And the reason why I'm saying this is because I know that as you talk about elders who have come here and worked very hard and to provide for their kids and to provide better opportunities for their kids. And I know that also there may be changes in the family structure, right? Where
Yeah,
the dad is no longer the leader of the pack, if you will, or the mom is no longer in charge.
yeah.
And can you talk a little bit about that?
Sure. It's a very interesting aspect. See, all their life, they were living independently. They raised a family in this country. And by the time they retire and the kids are independent, they have their own families. Sometimes the kids, in the name of like we are taking care of our parents, they try to impose their own things on the parents. saying that, oh, you should do that, you should not do this, you should be like this. Those are kind of little difficult for these seniors, because when they come to our senior centers, that's what they talk. Oh, my son said this, my daughter said this, or my son-in-law said this, daughter said this. And some of the things, I can never forget a case which I have seen in a nursing home when I was doing a consult. This gentleman, they said, oh, he never had any psych problem. All of a sudden, he said he wanted to kill himself. So I went there and he was happily playing something. I asked him, this is what they called me for. And what is it? What's going on? He said, look, doctor, I came to this country 30 years back. I raised my 7 children in this country. He's from Guyana. And I raised 7 children. They all settled well. And my daughter said she is going to come and pick me up when I get discharged from here after the physical therapy. And all of a sudden now she said, oh, it's not possible for me. And maybe I raised 7 children, and 7 children could not do anything for me when I really need help. And it is not just, I'm not talking about only South Asians. I'm talking about, I met another lady, she is a white American who was very well accomplished. And casually, when she was talking to me, she said, a mother can raise 5 children. She has 5 children, but 5 children cannot take care of a mother.
Wow.
It's really, really bothered me. And another time, I have seen a couple from Delhi. They came here because the 2 sons settled here. And the wife was kind of worried about her husband's medical condition. She said, we live in this apartment. Of course, the home health aide comes in the daytime. But in the nighttime, what if something happens to my husband? My husband falls down. And how can I help him? He's a big guy and I'm very tiny. And I said, you have 2 children and are you not living with them? She said, no, no, no. One son lives in Long Island, one in New Jersey, but they have no problem spending money for us, taking a special apartment, paying for all the things. They have money, but they don't have the time or resources to take care of us, them at home. And that's what actually made us to start our new project called Co-Living for Seniors.
Wow. Tell us more about that, please.
So this during COVID time, we realized some of our seniors lost their partners, either wife or husband, because seniors were more vulnerable to the COVID. So I was thinking about the housing projects for quite some time, and our board also was thinking like, yeah, it is important, it's needed. Even our housing needs assessment survey, we have seen like there is a need for housing. And as a healthcare provider, I keep seeing the patients ending up in emergency room and hospitals because there is no proper housing. And so I thought we have to address that issue. When I realized the co-living is very popular in millennial generation, young generations, young professionals or students, they share a house, they share an apartment. They have their own rooms separately,
right,
but common areas like kitchen and dining and living room, they're all common.
Right.
So I thought, why not we try this for our seniors?
Mm-hmm.
The seniors who would speak the same language, who would eat the similar kind of food, who would share the similar kind of culture. So we purchased a first home, single family home in Floral Park 2 years back. And we got some grants from New York Community Trust and Leslie Samuel Foundation. And we added the bathrooms to individual bedrooms so that the seniors will have their own privacy of having a bedroom and bathroom, and other areas are common areas. So we just started this, and we have 4 seniors living in Floral Park co-living home. We will invite you to come and visit it in person and do the interviews with seniors too. And
wow, that would be terrific.
It became a very popular thing. Then we purchased 2 more properties in Jamaica to develop the affordable and enriched housing, affordable and supportive housing in collaboration with AFI, Asian Americans for Equality, as a developer for the project. And in that house also, there's a lot of Bangladeshi seniors. They needed housing. They live in the neighborhood. So we started another 5 seniors are living over there. And we purchased another property to develop enriched housing and assisted living for South Asian seniors. That also, in the next 2 months, we are planning to start that as another co-living.
Wow, what a brilliant idea. What an absolutely brilliant idea. I would love to interview them if they're interested, to learn more about it. I wanted to ask you one question that I forgot, and this is about misdiagnosis in psychiatric disorders and mental health disorders. the DSM, I don't know what number we're at now, 4, 5, 6, whatnot,
Yeah.
at 5. And like, what has been that your experience with that as well? In the community that you serve and also when you work the hospitals and nursing homes?
Yeah. I mean, right now I work at Jamaica Hospital weekly, one day only, because most of my time is tied up within their home.
Great. Yeah.
But what I see is, interestingly, some of the social problems, since we don't have the resources to sort them out in a hospital setting, we tend to label them. Because I have seen one lady coming from Richmond Hill, and I saw her in 1 month time 2 times in a row. And so I was a little surprised. I asked her, third time she was there again, sitting in front of me. So I asked her, "You were here 2 times last month. What is it that you are here? Why is it? What's making you to come here again?" You know what she told me? She said, "Look, I told you I lost my husband and I live with my daughter, and my daughter has to work. She goes to work, and I'm feeling very, very lonely here.
Mm.
And I feel so sad. When I come here to the hospital, I feel so happy because there are nurses, there's staff, and there are doctors for me to talk to. So, what she needs is somebody to talk to. We can't put a label on her saying that she is depressed because she
Mm-hmm.
is feeling sad. So, I found we have a center in Richmond Hill area in a temple. So, I gave her the address. I said, call this staff member and they will make sure like you can come to there. You go there every week, once in a week, you make new friends, you enjoy the life. And that is, it is not only just for that. Sometimes people come in the weekend, I mean, in the summer, hot summer or winter with a lot of snow. They come there just to have overnight stay in the hospital, to have a good food for the night, which
Wow.
is very sad. Next day, they tell very clearly, "Oh, doc, I'm feeling fine. Let me go." And
Really?
it is not that they wanted to exploit the system or something, but they don't have a place to go. And they come here, and hospital cannot solve the social work problem, social
Right.
service needs.
Mm-hmm.
And at the most, we can refer them. And sometimes people will come with abusive relationships. Woman gets abused, or they feel very depressed. They don't know how to get out of that situation. Then we refer them to another organization called Saki, which helps the people with abused
Mm-hmm.
women. They
Yeah.
get a lot of resources.
Mm.
So, and there is a big gap between the hospitals and
The
CBO,
community.
community-based organization.
Yes. Yeah.
Unless we bridge the gap, the services will not be. In fact, if
Yes.
we
I
bridge
agree.
the gap, then the hospital ER visits, hospital admissions, everything will be cut down. And I believe instead of spending more healthcare dollars, they have to spend more dollars into community based organizations.
Yeah, which leads to another discussion that I would love to have with you about mental health or psychiatric diagnosis and homelessness and housing. And that's for another interview.
Sure.
And I get so my few, I guess I have just one or two more questions left. So can you
Sure.
tell us about what do you think will help the senior South Asians that you work with, the community that you serve, to live happier, healthier lives?
We have this saying, roti kapada or makan, right?
Mm-hmm.
Roti is bread, something to eat, kapada to cover yourself properly, whatever weather it is, and makan is the house, right? These
Wow.
are basic needs. The basic needs, it hurts me to see in the most richest and developed country, we are still facing people having hunger problems
Mm-hmm.
and not having healthy food to eat
Mm-hmm.
and not having housing. So I feel the basic needs have to be met, and that's number one. And the other thing is to have a purpose in life, right? Just because you are retired or you are
Right.
above 60, 65, that doesn't mean that there's nothing for you to do other than, just counting or chanting or praying or something like that. Maybe you can involve them as volunteers into advocating. Like, for example, some of our seniors, not only they volunteer for our serving food or doing activities at senior centers and dementia daycare, they also help to reach out to the elected officials advocating for the organization.
All
Like,
right.
this is what, yeah, they go and they give the advocacy, even sometimes not just in English, in Gujarati and Hindi and Bengali. So the city council members would understand the language need for this kind of things. They meet with them, and in fact, believe it or not, they traveled all the way to Albany to represent the state, meet with the senators and assembly members, and tell them the need for this. So it gives them a purpose, right?
Yes.
Yep, yeah. And we are, in fact, this summer, we are planning to start something called Intergenerational program, where the seniors with their life experiences can guide the younger generation. Younger generation can help the seniors with technology. They can help them how to use an iPhone or a tablet or a computer, right? Whereas the seniors, like for example, somebody might be retired as a lawyer or a professor or a scientist, so they can give little guidance to the students. How is it if they want to get into medical field, what is it that they need to do? Or if they want to be a scientist or a public health professional, what is it that they need to do, right? So that kind of intergenerational programming we want to start this summer.
Yeah. Oh, wow. That is absolutely terrific. Thank you so much, Dr. Kalisapudi. This has been absolutely incredible. I've learned so much. Thank you for your time, for your mission, for your work, your contribution to the community, and your continued efforts to thrive and grow and help the lives, actually help the Southeast senior Asians grow and have productive lives post retirement. So,
Thank you. Thank you, Dr. Ganesh, for this opportunity.